Early 2017, me and my husband decided we wanted to start a family, and we were very lucky to get pregnant very quickly. I automatically thought, this is it. I was like straight away looked at my due date, when I'd go off on maternity, all that kind of thing. But we lost that pregnancy a few weeks in, and then we went on to have another 2 miscarriages. So I had 3 miscarriages that happened between March 2017 and September 2017. They all ended between 5 and 7 weeks of gestation. I'd get to the scan and there would be no heartbeat. It was devastating because I blamed myself, that it was my body letting me down. People would announce pregnancies at 12 weeks after the scan, and so because losses that I were having were before 12 weeks, I felt like they wouldn't count to people. I had people say things to me like, oh, just see it as a period, and all these kinds of things. And actually, once you have a positive pregnancy test, you plan that baby into your family and into your life, and it is a baby. After my 3rd loss, I was referred by the EPAU, Hull Women and Children's, to recurrent miscarriage on the NHS. The waiting list was very long, and my frame of mind at the time, I was just desperate to know that I could have a baby, and I couldn't wait around. We were fortunate, me and my husband, that we were able to afford to go private with the help of our families. While we went through that process, we had a 4th loss, we had another loss. We went down to London and had testing done. We had a lot of testing done that we paid privately for, and I was found to have high natural killer cells. So basically my body was attacking the babies as a foreign object within my body. I was given the option of having immune suppressant treatment. Basically the idea was to fully wipe out my immune system so my body wouldn't attack the baby. And it worked. That resulted in our son, Ted. The treatment made me very ill. It was a really high-risk pregnancy. I was in hospital a lot, and it was a very anxious pregnancy. Even though it was working out, every single day I was just ticking off getting to bedtime and the baby still being alive. And you'd go for a scan and see the baby was still alive, but then by the next day in my head, the baby maybe wasn't alive anymore. Like nothing really ever gave me full reassurance that it was going to work out. In lockdown during 2020, we wanted to try for a sibling for Ted. I felt that I was able to try without the treatment in a way to I wanted to really be able to tell myself it was the treatment and it wasn't this roll of the dice that people say and it was just a miracle. I had a miscarriage beginning of November 2020 and it ended the same way as the others. I think it hit me harder because now I knew what it was like to actually physically have a child and a baby, but then we decided straight away that, to just go for the treatment. So I had all my treatment at home for my 7th pregnancy with Blossom, which again, straight on the treatment. Blossom survived and she was born in July 2021. I'll be forever grateful for the staff and the recurrent miscarriage consultant in Hull that really have listened to me and definitely made my experience better and made me feel like I've got a voice. I think it's important for women to feel like they've got a voice about their own care. When I've been worried that they'll see me for a reassurance scan, they've done bloods to check how the pregnancy is progressing, and I think they've known that helps with the mental health side of it, that actually is the anxiety in each pregnancy. I've become a patient representative for the EPAU, so I've attended their meetings, supervision meetings, to sort of feedback on behalf of myself and other patients that I work with in my support group. And it's a great thing that they are listening and improving things. They're moving the antenatal day unit so that women that are going through recurrent loss don't have to see people with huge bumps having a good time. It's really hard to see people that are having a good time when you're having a bad time. I provide the EPA with bracelets to give to women when they've had a loss. It's just a little memory bracelet so people don't feel like they're walking out with nothing when they've lost their baby. And I left some business cards about the support group that I run. It's a peer support group. We work together and they promote the charity, they promote the group. The charity's motto is never give up on a bad day. There's always a bad day, and when you found out you've lost a baby, it is a bad day, but you can't decide to throw it all away and give up on that bad day. You have to wake up tomorrow and think about trying again, and there are people that will support you through what you're going through. And I always just say keep on chasing rainbows.